Australians are paying around 3% more for health insurance this year, but the 12 million people with private hospital cover are also facing high out-of-pocket costs. A recent survey has found around 50% of respondents who had private health cover were shopping around or making sacrifices to afford it. Senior reporter Fiona Willan.
Stacey Christopher has long had private health insurance to take care of her family. And now that her children are adults...
Got the wedding coming up soon, very exciting.
The Sydney mother keeps her cover to take care of herself. She recently needed to use it urgently.
I had a bit of an issue with my bladder and I had to go see a specialist in regards to that. And unfortunately, the only solution to the problem was to have surgery.
But when she found out how much the surgery would cost, she had second thoughts.
I couldn't believe how much the out-of-pocket costs were, to the point almost where I didn't go ahead with the surgery. It was a lot more than I thought it would be.
The latest figures from the financial watchdog show the average out-of-pocket cost for hospital treatment rose $29 in the year to June, an increase of 7.1%. It's due to a range of factors, including some specialists increasing their fees.
It's a high inflation environment. I think Australians understand the cost of living crisis, and this is another aspect of that.
And health insurers say they can't keep raising benefits.
What health funds can't do, they can't keep chasing higher and higher fees, which are inflating, with extra rebates, because that just causes an inflationary spiral that goes up and up and up.
We know with the increased costs of seeing a specialist, getting a scan or having elective surgery, people are putting those things off now.
A recent survey by National Seniors Australia found some older Australians are going without basics to afford private health cover, and gap fees are a top concern.
We've had situations where $800 has been quoted in advance of the surgery, and then there's a conversation afterwards saying, well, actually, it's not $800, it's $10,000 out of pocket.
They're seeing their premiums go up, and I'd argue that they're not really seeing a benefit from that.
Doctors argue the government needs to do more to reduce medical bills, saying patients are also paying more to see specialists outside hospitals where appointments aren't covered by private insurance.
The Medicare rebate that patients get from Medicare has not kept pace with rising inflation. In fact, it's dropped off by about 60%.
The Health Minister, Mark Butler, claims over the past 2 years, the government has delivered the two largest increases to Medicare rebates in 30 years, adding the private health sector, including insurers and specialists, need to do more to protect Australians from exorbitant bills. Around 45% of Australians have private hospital cover. Those who can't afford it need to rely on the public system, where in some cases they may be forced to wait years for certain surgeries. Stacey considered joining the public queue, but decided her operation couldn't wait.
It would have affected my work life, my home life, my social life, all round.
She went ahead with it in the private system, but knows not all Australians would have had the choice. Fiona Willan, Sky News.